A new COVID-19 variant, which has led to a spike in new infections in the United States and Europe, has now been detected in South Africa. But the National Institute for Communicable Diseases says that there's no need for panic. For more on the JN.1 variant, let's speak to the NICD senior epidemiologist, Dr Sibongile Walaza. Dr. Walaza, we're grateful for your time. A very good evening to you. Let's talk more about JN.1. What is it and how does it differ from everything that we've seen as far as variants and subvariants, especially from around when there was confirmation of the existence of Omicron?
Good evening, Temekile, and good evening to your listeners. So yes, you correct. We've also identified cases of JN.1 in South Africa. This is a new variant, which has been designated as a variant of interest. And the reason for that is because it's shown that it's got abilities to evade the immune system. So it has an additional, mutation in one of the spike proteins, which is the protein that it uses, which is to attach to the cells. And so the difference between the others is because this variant is showing that it's increasing in numbers of people who are infected, and also it's increasing in proportion compared to the other variants that were circulating. But it is also, it is the subvariant of the previously existing variant.
And once you do have JN.1 then, does it behave differently to Omicron? I remember 3-4 years ago, whenever we speak about variants and new subvariants, one of the questions was about the severity of illness, etc.
So at the moment, the data still is limited, and the reason for that, again, is because there's still a few cases where they've been sequencing. But from the cases or from the data that is available, there's no indication to show that this is more severe than other sublineages or variants that are co-circulating at the moment.
And do we need to change course? Pardon me, doctor, please complete your point.
And then I was going to say, in terms of our presentation, again, data is still very limited, but patients are still presenting similar to what we've been seeing with the recent variants that were circulation.
Is there clarity in South Africa as to how widespread JN.1 may already be, perhaps especially now that we're hearing that it's driving up infections in places such as Europe and America?
So in South Africa, in the recent months, like November, December, we had few cases, positive cases to start off with, that had been reported and been sequenced. And from those, in November, this variant contributed about 3%. Out of about 200 samples that were sequenced. So these numbers are very small. And then in December, and again, also it was 16%, so it was 6 cases out of 37 cases. And so far, we've seen it in the 2 provinces from Gauteng and Western Cape. But again, I think also just important to stress that we're dealing with low numbers at the moment.
And what you had...
And also, I think important again to note that yes, in Europe or the Northern Hemisphere, they're seeing a high number of cases, and this may be due to a number of reasons, in that this is their winter season. So they're already having increases in other respiratory illnesses like influenza and RSV. And because it's winter, then people close they stay in closed environments, and also ventilation is not good, so it's easier for viruses to spread. Whereas in our setting, we're currently in our summer period, which is not typically the season where we see a lot of respiratory illnesses.
Do we have enough protection against this? And I ask that question with a caveat, of course, that you are still basically on a fact-finding mission to truly understand JN.1 and perhaps how it differs from what we know about the other variants and subvariants, etc. But, for example, the vaccines that we have all taken, not all, but many of us have already gone for, people have gone for booster shots more than once in some instances. Will that be enough?
So in terms of protection, right, so protection depends on a number of things, right? So it can be from previous infection and also from the vaccines, as you've mentioned. And again, together with that, so hoping that, again, also we understand that there's a high level of immunity in the communities. And with that, then we're still encouraging people that, I mean, those who are at risk of severe disease, they should still go for booster shots in order to protect themselves. But as you say, I mean, it still remains to be seen. Whereas in countries where they've got more recent vaccines, WHO believes that it should be in the previous vaccines that they've had should be able to. There still should be some cross reaction, but also, as I said, it also depends on the level of immunity in the communities.
Dr. Walaza, to what extent should we still concern ourselves with discoveries, confirmations of new variants, as is the case with JN.1 at this stage? Because a lot of people, I mean, even the health department stopped giving us daily updates on the number of cases, for example, people infected, people who've died. A lot of people have gone and been vaccinated. There is a generally accepted position that immunity, to a large degree, has been achieved.
So I think as long as there's still SARS-CoV-2 circulating in the communities, right, there will still be new variants that are circulating, right? And some people will still be at risk of getting the infection, and some people will still be at risk of getting severe disease. But then, again, in terms of what we still need to worry about at this moment, I think there's no reason for concern. And as I think we mentioned earlier, that the WHO has already made an assessment that really there is a low risk they're assessing this as a low risk to the global population. And so we're still reporting, even though it's not on a regular basis, but then there still is monitoring and there's still surveillance for SARS-CoV-2, and it's monitored as part of other respiratory pathogens that are circulating. So we're still doing that type of surveillance, but it's not as intense as we're doing before. But I think it is part of that we live with of other, like as in other respiratory pathogens. So, yeah, we should continue. I mean, if there is any things or any signals, then we'll be in a position to report and let you know. But at the moment, there's no reason for concern.
Dr. Walaza, thank you so much for your time tonight. Thank you.